Hi, I'm Heather McCormack. I'm from the New South Wales STI Programs Unit, and I'm here to talk to you about an online sexual health promotion campaign for Aboriginal young people called Take Blaktion. Take Blaktion was established to address disparities in sexual health outcomes for Aboriginal young people. So, as we know, Aboriginal young people have a higher prevalence of STIs than non-Aboriginal young people. Early findings from our festivals project found that Aboriginal young people were more likely to report a new partner in the last 3 months and less likely to report condom use. But what we thought was more significant was that they were less likely to report that they think their friends use condoms. Social norms like this are a really important influence on sexual behaviour. And we also know from previous work that shame and stigma are major barriers to condom use and STI testing for Aboriginal young people. So in light of this, a need was identified for an Aboriginal-led campaign to empower Aboriginal young people to take charge of their sexual health. We engaged Aboriginal young people in the planning and design of the campaign from the start, and they told us to make it funny, and they told us to put it somewhere where they already were. The campaign ran from 2015 to 2017 and then went on hiatus. It's a partnership between the STI Programs Unit and the Aboriginal Health and Medical Research Council of New South Wales, and it's supported by an advisory committee made up of Aboriginal health workers from across New South Wales, and they provide a really diverse regional and frontline perspective. They give input into every aspect of the campaign. The core components are the use of high-profile comedy ambassadors, comedy sketch videos, and activations at key community events. The campaign uses a uniquely Aboriginal humour to circumvent shame and connect Aboriginal young people to relevant and appropriate sexual health promotion. Now, comedy has a long history in Aboriginal media, in everything from written fiction to theatre to comedy skit shows like ABC Black Comedy, where several of our ambassadors first hit the public eye. When it's used effectively, humour can diffuse discomfort that surrounds sensitive topics. It's sometimes easier to talk about these topics if you can have a laugh about them. Also central to the campaign was our use of a strengths-based approach. Discussions about Aboriginal health and about Aboriginal people in the context of health really often focus on a deficit narrative. Recommendations from the Lowicher Institute are to use strength-based approaches to challenge deficit narratives and encourage alternative strategies for addressing health issues. To put this simply, we don't want to make people feel bad about themselves. We want them to think creatively about what they can do to look out for their own health and the health of their partners. In 2018, we received an additional 3 years of funding, with the campaign recommencing in 2019. So this is where I joined the team, and we relaunched with 3 returning ambassadors who had previously participated in the campaign. We had an increased budget, which meant we could facilitate higher production values and include more promoted content to reach a broader audience of people who are not already engaged with our channels. Each year we ran a sexual health training workshop that was delivered to the ambassadors by the Aboriginal Advisory Group, and it covered key thematic areas of STI testing, condom use, healthy relationships, and inclusivity. The ambassadors then participated in a 2-day intensive of scripting and filming to produce video content. So these are the 6 key thematic pillars for the campaign. The first 4, condoms, STI testing, community language, and comedy ambassadors, have been central to the campaign from the beginning. And the last 2, healthy relationships and female empowerment, were included in the 2019 revamp of the campaign following evaluation and particularly feedback from young women who participated in that evaluation. These pillars inform development of the skit videos that are central to the campaign. They inform the work done at our event activations, and we incorporate content based on them into each month's organic content plans. So when we relaunched the campaign, we completely revamped the website, which had previously just been a landing page with some videos. Informed by the evaluation of PlaySafe, which is our mainstream youth program, we reskinned some interactive elements that had performed really well with the PlaySafe audience. So as well as a video library, the Take Blaktion site now includes an STI quiz, which helps young people suss out if they need to get an STI test, a service locator to help young people find free testing services near them, True or Gammon, which is our sexual health myths and facts quiz, and Nurse Nettie, which is a Q&A portal where young people can ask confidential questions of a real sexual health nurse. So the pandemic obviously had a significant impact on the campaign. The Ministry of Health reviewed all social media channels and campaigns to determine which could continue in the context of COVID-19 and which had to be shelved. The Ministry recognised that Aboriginal young people still need safe sex information, even in a context where casual sex is being discouraged. So we were allowed to continue with some reorienting to emphasise safe sex for young couples and people in relationships and less focus on casual sex. But it was also recognised that our audience likely don't have contact with other New South Wales Health social media channels. So we were asked to incorporate COVID-19 messaging into our campaign strategy. We redirected some funds from events that had been cancelled into 3 skits featuring messaging on hand washing, mask wearing and social distancing. And with this, we really lent into the principle of reach the audience where they already are. We'd spent several years engaging an audience around sexual health messaging and establishing ourselves as a trusted channel to deliver that messaging. So we were then able to leverage this trust to communicate adjacent messaging about staying safe during the pandemic. Campaign performance in both years since we substantially increased promoted content has exceeded most KPIs, and the 2020 campaign outperformed the 2019 campaign. In both 2019 and 2020, we reached over 500,000 people and delivered over 5 million impressions with an engagement rate of over 5%. Our content continues to reach more young women than young men, but we do have a sizable minority of young men viewing our content, particularly on Instagram. They're just much less likely to engage with the content or to actually follow the page. We can't rely on social media analytics to get a full picture of the effectiveness of a campaign encouraging behaviour change, of course. So in year 2, we commenced survey collection with Aboriginal young people across New South Wales in collaboration with the Centre for Social Research and Health. And this is feeding into an ongoing evaluation to measure change in attitudes and behaviours. The evaluation survey launched at the end of the Year 4 campaign, and it's a longitudinal tool that aims to compare trends in sexual health behaviours and attitudes related to condom use and STI testing. And we're looking at both a cohort of people who were exposed to the campaign and a cohort of people who were not exposed to the campaign. As you may be aware, robust evaluation data on sexual health promotion activities targeting Aboriginal young people is quite rare, and this presents an ongoing challenge for people working in this space. We've seen so many successful programs delivered that can't be scaled up because their budget wouldn't stretch to resource evaluation, so there's been no concrete evidence that the program delivered on its objectives. Because of this, we're committed to a robust and comprehensive evaluation of this program and hopefully a meaningful contribution to the evidence base on what works for health promotion and health communication campaigns targeting Aboriginal young people. So I'll stop talking for a moment and let you see some of the campaign creative.
If you're mother looking for some interaction, the kind that bring love and satisfaction, take a moment before you take action. Play it safe and take Blaktion. It ain't a joke when having a poke to risk an STI that can make you folk broke. So take a moment, think of what's words spoken. Take Blaktion, be strong for folk.
What are you doing in our room?
Yeah, we're trying to have some alone time.
Hey!
Take Blaktion. Wait, condoms. Get tested.
Get out!
Okay.
That was weird, eh?
Catchy tune though.
True, eh?
And here's where to find us. Thanks for your time.